Welcome to this deep dive. We're really thrilled to have you with us today because our mission is to demystify a phenomenon that affects, well, nearly half of the adult population.
That's right.
If you're listening right now, there's a 50% chance you've dealt with this personally. Yet it's almost never talked about in casual conversation. We are talking about skin tags.
Yeah, that's entirely true. They're incredibly common, totally harmless in and of themselves, yet they can be these incredibly annoying little bumps that just seem to show up out of nowhere.
Right.
And it's completely valid if you've ever found yourself staring at one in the mirror, wondering what exactly it is and, why it decided to set up camp right on your neck.
Exactly.
Yeah.
But we aren't here to give you a dry, boring medical lecture.
Mm-hmm.
Think of this as an intriguing exploration into one of the body's strange little quirks.
Mm-hmm.
And to guide us, we're relying on a comprehensive medical and lifestyle guide. It's titled Skin Tags: Causes, Risk Factors, Prevention, Removal, and Treatment.
It's a great piece.
It really is. And it was just published today, March 11th, 2026, by researcher Nikki Chase over at Era Organics.
It's a fantastic, highly detailed resource. What Nikki Chase has put together really bridges the gap between the clinical science of dermatology and the everyday reality of living in human skin.
Yeah.
It takes the mystery out of something so many of us experience.
And while most people just write skin tags off as purely cosmetic annoyances like something you just hide under a turtleneck or a scarf, the research actually points to something much deeper.
It really does.
They can actually serve as an external dashboard warning light for some pretty serious internal health metrics.
Absolutely.
We're going to get into that fascinating connection shortly, but before we do, let's lay down the groundwork.
Okay.
Now let's unpack this. What exactly is a skin tag?
Well, on a biological level, a skin tag is a benign, meaning non-cancerous outgrowth of the epidermis. If you were to look at one under a microscope, you wouldn't just see a flap of dead skin. It's actually a really complex little structure made up of core fibers, nerve cells, fat, collagen, and small blood vessels.
Wait, blood vessels and nerves?
Yeah, it's a cluster of living tissue extending outward, usually attached to the body by a tiny, thin stalk.
Which sounds kind of intense when you describe it as a cluster of living tissue.
Yeah.
But they're usually tiny, right?
Oh, yeah, very small.
We're talking anywhere from 1 to 5 millimeters, though the Aero Organics guide notes they can sometimes reach several centimeters in diameter in extreme cases.
Right, those are the outliers.
Now, for those of you listening who love clinical trivia, what do doctors actually call these things when they're writing up a chart? I assume it's not skin tag.
Well, the medical literature loves to have a dozen names for the exact same thing.
Always.
The most common scientific name you'll encounter is acrochordon. But depending on what medical journal you're reading, you might also see them referred to as cutaneous papillomas, fibroepithelial polyps, fibroma molluscum.
Fibroma molluscum, wow.
Right. Or soft fibromas, or even this great historical term, Templeton skin tags.
I have to say, Templeton skin tags sounds so much more aristocratic than just skin tags.
It does.
Like it requires a monocle.
Okay.
But let's break down one of those terms because fibroepithelial polyps sounds terrifying if you don't know what it means.
It really sounds intimidating, I know, but it's just literal descriptors mashed together. Fibra just refers to the fibrous tissue that makes up the core, and epithelial refers to the epithelium, which is just the top layer of your skin.
Ah,
And a polyp is just a small growth. So fibroethereal polyp literally just means a small fibrous skin tissue bump. Nothing more sinister than that.
that makes so much more sense.
Yeah.
Now, regardless of whether you call it an acrochordon or a Templeton tag, the demographics are fascinating.
Yes.
Almost half of all adults get them. The risk increases once you pass the age of 50, and it affects men and women equally. But what really caught my eye is the primary culprit behind why they actually form. It's something so incredibly mundane. It's friction.
Precisely. Friction is the main driver. The body basically produces extra cells in the top layers of the epidermis in response to areas where skin constantly rubs against other skin or against your clothing. It's essentially an overzealous physical response to mechanical rubbing, and it usually happens in deep skin folds where moisture and heat get trapped, which just exacerbates that friction.
So when we say friction, we're talking about the body trying to build up a defense, almost like a callus. But instead of a hard, flat surface, it forms this tiny, fleshy stalk.
That's a really great way to visualize it. But it's not just friction acting alone. Hormones play a massive role in this
Oh,
process.
interesting.
Yeah, hormonal shifts are major catalysts for skin tag development. For instance, pregnancy frequently triggers a rapid growth of skin tags.
Makes sense.
Weight gain also contributes significantly, and not just because it creates more skin folds and therefore more friction.
Right. It's also about the underlying metabolic and hormonal changes that accompany that weight gain, which we'll dive into in a minute.
Exactly.
But first, let's talk about where these things actually show up. If friction is the match that lights the fire, where are the body's hotspots? I mean, it makes perfect sense that you'd find these wherever clothing heavily rubs against the skin.
Absolutely. The neck is prime real estate for this.
Oh, for sure.
You have constant, repetitive rubbing from shirt collars, necklaces, and other jewelry against the cervical location. That continuous mechanical stress causes these small, fleshy bumps to develop right across the neckline.
And the same logic applies to the armpits, right?
Yes, very common.
Your arms are constantly swinging as you walk, your shirts are rubbing right up into the underarm, and it's an area that naturally traps heat and sweat.
Exactly. Skin tags in the armpits often look like soft hanging flaps. And the biggest daily nuisance for a lot of people is that they're notorious for catching on razors,
Oh, God.
which can be quite painful because, as we mentioned earlier, they have their own nerve cells and blood vessels.
I can practically feel everyone listening wince at the thought of catching one with a razor. Ouch.
It's not fun.
We also see this same friction mechanism in a broader region, like the legs, the groin, and under the breasts.
Right. We group these together because the cause is identical. It's intense skin-to-skin or skin-to-clothing contact. You see this constantly with athletes or people wearing tight pants, causing friction on the upper thigh or inner leg. You also see it in the pelvic region due to trapped moisture and rubbing, or in the submammary area beneath the breasts. It's also very common to see them in the creases of the arms, specifically the elbow crease or the inner upper arm, where soft, fleshy protrusions can form that move easily when touched.
Okay, so the friction areas make total sense. But Nikki Chase's research also points to a couple of spots that really caught me off guard. The eyelids, for one.
The eyelids are a particularly sensitive hotspot.
Really?
Yeah, the skin there is extremely thin, and it's constantly folding every single time you blink, which is thousands of times a day. When skin tags form here, they typically occur near the lashes or right on the natural folds of the eye.
And I imagine you don't want to mess around with anything growing that close to your eyeball.
You absolutely don't. Because this tissue is so delicate, you need an ophthalmologist with a very steady hand to handle them. They generally use precise cryotherapy or surgical excision just to ensure the ocular surface is completely protected during the process.
Good to know. And the final hot spot mentioned in the guide is the lips. I would never have thought of the lips as a high friction zone.
They're definitely less common there, but they do occur near the edges of the mouth. What's fascinating here is the highly vascular nature of the mucosal area. In plain English, your lips have an incredibly rich blood supply.
Which sounds like a double-edged sword. It bleeds easily, but it heals incredibly fast.
Exactly. If a specialist removes a tag from the lip, which requires incredible precision so it doesn't leave scar tissue that interferes with eating or speaking, the area actually heals exceptionally quickly thanks to that robust blood flow.
Okay, so we know what they are, we know they're made of living tissue, and we know they love friction hotspots. But here is the burning question for anyone who suddenly discovers a weird, fleshy bump on their body. Are they dangerous? Are we looking at a cancer risk here?
The short, highly reassuring answer is no. Skin tags completely lack the cellular ability to turn into malignant tumors. They are entirely benign.
That's a relief.
It is. However, this raises an important question about misidentification. Because while a true acrochordon is harmless, there are several dangerous lookalikes out there that people frequently confuse for skin tags.
Right, the imposter bumps. The Era Organics Guide details a few conditions you absolutely do not want to mix up with a harmless friction bump. Moles, for one, which are typically pigmented, darker, and usually flat against the skin without that little thin stem.
Correct.
Then you have warts, which stem from viral infections like HPV and tend to have a rough, irregular surface, unlike a soft, smooth skin tag.
You also have to watch out for seborrheic keratosis. This causes these spots that have a very distinct, waxy, almost pasted-on appearance.
Like candle wax.
Yes, exactly like a dollop of candle wax on the skin. And most critically, you have basal cell carcinoma, which is a very real type of skin cancer that can initially appear as a persistent bump or a small, shiny sore that just won't heal.
And this is exactly why self-diagnosis is incredibly risky. You might think you're just dealing with a little friction bump from your collar, but you could actually be ignoring something malignant.
Yes.
But let's say a doctor checks you out and confirms they are definitely just skin tags. You're entirely in the clear. Well, not exactly.
If we connect this to the bigger picture, this is where the medical research gets incredibly compelling. While the tag itself won't harm you in any way, its presence, and particularly the sudden multiplication of many skin tags all at once, is deeply linked to serious systemic health factors.
This is that dashboard warning light effect we talked about at the top of the show. I find this absolutely mind-blowing. Your skin is essentially flashing a physical warning sign about your body's metabolic engine.
It really is.
The guide lists 7 major systemic risk factors strongly associated with skin tag outbreaks.
And the most prominent one by far is insulin resistance. Multiple studies show a strong correlation between the presence of numerous tags and how your body processes glucose.
Let's really break that down, because I think a lot of people hear insulin resistance and just think of blood sugar. But how does that equal a skin tag on my neck?
It's a fascinating biological chain reaction. When your body struggles to use insulin effectively to move glucose into your cells, your pancreas pumps out more and more insulin to compensate.
Okay.
That excess insulin circulating in your blood actually acts as a growth-promoting hormone.
Wow.
Yeah. And one of the bizarre side effects of this is that it signals skin cells, particularly in those friction-heavy areas, to multiply rapidly.
So the skin tags are a direct visual manifestation of your body struggling to process sugar.
Exactly.
And that naturally links right into the second risk factor, which is metabolic syndrome, which is a cluster of conditions that dramatically increase your risk for heart disease and diabetes.
Oh, yes. And speaking of heart disease, the research heavily links skin tags to atherosclerosis, which is the physical hardening and narrowing of the arteries.
That's terrifying.
Chronic heart conditions consistently show a correlation with skin tag frequency. It's believed that the same systemic inflammation and cellular proliferation that causes plaque to build up in the arteries is simultaneously encouraging those skin tags to grow.
The source also points to obesity as a major factor, which makes sense mechanically because it leads to more deep skin folds and friction, but it obviously also ties back into the hormonal and insulin issues we just talked about. Add to that dyslipidemia, which means abnormal cholesterol levels like high triglycerides and hypertension or high blood pressure.
When you look at that full list, insulin resistance, metabolic syndrome, hardened arteries, cardiovascular disease, obesity, abnormal cholesterol, and high blood pressure, you realize these tiny flaps of skin are practically screaming at you.
Yeah.
They are offering an early warning system, suggesting it's time to get a comprehensive blood panel done.
That is a massive takeaway for you listening. If you suddenly break out in a dozen skin tags on your neck or under your arms, don't just go buy a turtleneck and ignore it. Go consult your doctor. It might be your body's earliest, most visible warning sign of diabetes or heart strain.
Exactly. Addressing the root cause is critical, which transitions perfectly into what you should actually do about the tags themselves once you've consulted that doctor.
Yes. Here's where it gets really interesting, because we have to talk about the overwhelming temptation of DIY removal.
Oh, wow.
We all know someone who's done late-night internet searches on how to get rid of them with dental floss or string or apple cider vinegar.
I know it's tempting, but it is crucial that you do not attempt at-home removal. The Era Organics data is extremely clear on this. It's easy to see why people try the DIY route, assuming they're just snipping off dead skin. But the reality is that at-home remedies and over-the-counter gadgets pose a severely high risk of complications.
I imagine the bleeding alone is a nightmare. Like you just told us, these things have their own blood supply. People probably think they're just clipping a hangnail, but they're actually cutting into live vessels.
That's exactly right. Excessive bleeding is a very common complication because of those tiny blood vessels. Furthermore, without proper sterile equipment and clinical technique, you can easily cause significant infection and lasting scarring to the surrounding tissue.
And what about the people who try to just tie a string or a piece of floss around the base to choke off the blood supply? I've heard that one so many times.
That method often leads to incomplete removal. The surface tissue might die off, but the core remains attached, which means the tag will simply grow back and usually get painfully infected in the process. But the most terrifying possibility of DIY removal goes back to what we discussed earlier: misdiagnosis.
Right, accidentally treating a cancer spot like a skin tag.
Precisely. Imagine accidentally using an at-home chemical burner or freezing kit on a basal cell carcinoma because you just assumed it was a friction bump.
Oh, that's bad.
You are essentially damaging cancerous tissue, which complicates the eventual professional treatment, and you are dangerously delaying a critical diagnosis.
Message absolutely received. Put down the scissors, throw away the string. And just to bust another myth highlighted by Nikki Chase, skin tags do not naturally fall off on their own. They don't just dry up and blow away in the wind like a leaf.
No, they are living tissue. They will remain attached indefinitely unless there is specific medical intervention. Fortunately, the professional toolkit is far safer, practically painless, and incredibly efficient. Dermatologists primarily use 5 clinical methods to handle them.
Let's walk through those so you know exactly what to expect at the dermatologist. First up is cryotherapy.
This is very common. The doctor freezes the tissue with liquid nitrogen, which instantly destroys the cells. Then there's excision, where they use a sterile scalpel or surgical scissors to cleanly and completely shave it off right at the base.
They also use cauterization, which I know sounds medieval, but it's just burning the tag using a precise electric current, which has the added benefit of instantly sealing the blood vessels to stop any bleeding.
There's also ligation, which is a clinical, highly sterile version of tying off the blood supply with surgical thread, usually reserved for tags with thicker stalks. And finally, laser removal, which burns and removes the tag with extreme precision using focused light, leaving the surrounding skin completely untouched.
But naturally, the first thing anyone is going to ask when you bring up freezing, cutting, or burning their skin is this going to hurt?
It's a very fair question, but the reality is quite comforting. Thanks to local anesthesia or highly effective topical numbing agents used in the clinic, it does not hurt. You might feel a slight pinch or a bit of pressure for just a few seconds. The procedure itself is incredibly fast.
And the recovery sounds surprisingly easy. According to the research, a scab forms over the treated area, acting as your body's natural protective barrier. The golden rule is to leave that scab alone. No picking at it, and it will naturally fall off in a week or 2.
Underneath that scab, you'll have slightly uneven or pink skin that might feel a bit tender, much like a minor scrape. But within a few winks, that fades entirely and the skin regains its natural color and texture. It becomes practically invisible.
But here's the million-dollar question. Will it come back? If I go through the trouble of getting a tag frozen off my neck, is it just going to pop up in the exact same spot a month later?
The short answer is no. A professionally removed tag will not grow back in the exact same spot because the dermatologist completely removes the foundational base.
Good.
However, if the underlying causes continue, meaning you're still wearing that tight collar or that insulin resistance goes untreated, new tags can easily form right next door in the same general area.
So what does this all mean for our daily routines? How do we stop the new ones from showing up in the first place? The Era Organics Guide translates all this clinical data into some highly actionable preventative steps you can start today.
The primary goal of prevention is a 2-pronged approach: reducing mechanical friction on the outside and improving metabolic health on the inside.
Okay.
Step 1 is maintaining a healthy weight to reduce the number of deep skin folds where moisture and friction thrive.
Step 2 is regular exercise. And what's so cool here is that this isn't just about weight loss. The research specifically notes that regular exercise actively improves your insulin sensitivity. By getting your muscles to use glucose more effectively, you're directly suppressing that rapid cell growth that causes the tags.
Exactly. Step 3 is purely mechanical. Simply avoid wearing tight jewelry or restrictive clothing that constantly rubs against your neck, your upper chest, or your underarms. Give your skin room to breathe. Step 4 involves keeping those friction-prone areas dry because trapped moisture severely exacerbates the rubbing.
And step 5, naturally, is scheduling regular dermatologist checkups to monitor any new developments and catch those lookalikes early. But beyond those big lifestyle adjustments, Nikki Chase also outlines a very specific daily skincare routine for people who are prone to skin tags.
It's a simple 4-step routine. First, gentle cleansing to remove sweat and natural oils that increase friction. Second, mild exfoliation to clear away dead skin cells and prevent clogs in those folding areas.
Sounds refreshing.
Third, moisturizing to keep the skin supple and more resistant to mechanical damage. And fourth, protection using talc-free powders or physical barrier creams to keep deep skin folds dry and minimize that direct skin-to-skin contact.
Now, speaking of creams, if you walk down any pharmacy skincare aisle, you'll see a dozen products claiming to magically erase skin tags overnight.
Okay.
The guide gives a really balanced, objective look at this. They mention products like healing ointments, soothing moisturizers, Aloe gels, and a gentle care cream called Honey Buns.
Those topical products do serve a valuable purpose, but it's important to set expectations. The moisturizing and aloe components in products like honey buns are fantastic for soothing the skin and reducing the physical friction that causes tags to form in the first place.
Right.
But over-the-counter creams that specifically claim to remove existing tags work by targeting the tissue with active ingredients designed to dry the tag out completely so it breaks down over time.
But the reality check here is that they aren't exactly a silver bullet, right?
Far from it. They are not totally reliable. First, they take weeks of consistent daily application to show any results at all. Second, those active drying ingredients often cause redness, swelling, and uncomfortable sensitivity on the surrounding healthy skin.
Ouch.
And while they might eventually work on very tiny, soft tags, they frequently fail completely on larger or more stubborn outgrowths. Once again, a quick, painless professional removal is vastly superior to weeks of messy creams.
It really is. So let's wrap up this journey. We've covered a lot of ground today. We've gone from understanding that acrochordons, or skin tags, are fundamentally born from the simple friction of living in our bodies, rubbing against our clothes and ourselves.
We've mapped out their favorite hiding spots, from the heavily trafficked neck and underarms to delicate, highly vascular areas like the eyelids and lips.
We've learned that while the tags themselves are totally benign and won't hurt you, ignoring a sudden massive outbreak is a terrible idea, because of their powerful link to systemic health issues like insulin resistance, metabolic syndrome, and cardiovascular disease.
Yes.
And most importantly, we've established that you should never, ever play surgeon in your own bathroom. Leave the liquid nitrogen, the lasers, and the scalpels to the trained professionals.
It's all about learning to listen to what your body is trying to tell you. Which actually leaves me with a thought I want you to mull over after we finish up here. If our skin acts as an external dashboard for internal metabolic issues, simply by forming tiny, harmless-looking friction bumps to warn us about something as serious as insulin resistance or cardiovascular strain, what other subtle signals is the body's largest organ sending us every single day that we completely ignore just because we write them off as purely cosmetic?
That is an incredible, profound question to chew on. Your body is always communicating with you. We just have to learn how to read the language. Thank you so much for joining us on this deep dive into the surprisingly complex world of skin tags. Keep paying attention to those warning lights, and we will catch you next time.